ओके।
प्रिपेयरिंग। अभी
हाँ, मुझे आ
5 मिनट
गया,
है ना।
ऑप्शन आ गया मुझे, मतलब दिख रहा है नोटिफिकेशन की मीटिंग इज बीइंग लाइव स्ट्रीम्ड ऑन यूट्यूब। वी कैन एक्चुअली गो लाइव एट 3:55 और 4 पे हम स्टार्ट कर सकते हैं बात करना, बट देन पीपल माइट नॉट जॉइन। इट्स ओके, 4 o'clock ही ठीक है।
हाँ, अभी लाइव है फिलहाल के लिए।
प्राइवेट है या पब्लिक है?
पब्लिक रहा, प्राइवेट रखे तो लोगों को नहीं दिखेगा।
कैमरा चेक कर रही हूँ मैं। Okay, got the message. Hello, Dr. Amit. Hi, Dr. Amit. Can you hear
Are
me?
we live?
Yes, Dr. Amit, we are live.
I can't hear you.
Um, Now, am I audible?
Can't hear.
Um, okay, I've reconnected my
I can't
audio.
hear you. One second.
Yeah, microphone.
Still can't hear.
I will rejoin, Dr. Amit. 1 second. Yes. Hi, Dr. Amit. Am I audible now?
Still can't hear you.
Um,
Strange.
have you
Leave
connected it
and
to
come back.
Bluetooth speaker maybe? Speaker maybe.
मुझे सुनाई दे रहा है।
I can't hear anything.
Dr. Amit, have you connected through Bluetooth speaker maybe?
Can't
I'll
hear
just
anything.
I'll just chat on.
Some issue. No.
No. Um.
1 second. Yeah, I can say something.
Yeah. Am I audible?
Yeah. Yeah.
Okay. So, Dr. Amit, we are live now. We can just start the session if it's okay with you.
Yeah, sure.
Okay. So, hello everyone. Good afternoon. Thank you for joining us in our YouTube live session today. Today is July 19th, a day dedicated to spreading awareness about glioblastoma. Glioblastoma is a highly aggressive form of brain cancer that affects thousands of individuals worldwide. Let me extend a warm welcome our esteemed speaker, Dr. Amit Jotpani, co-founder and chief of oncology at Onco Cancer Centers. Dr. Amit brings a wealth of knowledge and experience to the table. Thank you, Dr. Amit, for joining us today.
Happy to be part of the discussion.
Thank you, Doctor. Throughout this live session, Dr. Amit will be providing valuable insights into glioblastoma, its symptoms, diagnosis, treatment, and more. But before we begin with the live session, I would like to share a few insights on onco-cancer care and onco-cancer centers. So basically, onco-cancer care is a user-friendly application built to simplify the cancer treatment planning. Patients can easily book consultations with any oncologist in the country. They can book lab tests. You can get free diet plans specialized in cancer treatment and get 24/7 assistance from our care managers. It's a application available on Android and on iOS for free. And basically, Onco Cancer Care has flagship centers in Hyderabad, known as Onco Cancer Centers, which are spread across various locations in Hyderabad, where we offer a comfortable space for cancer treatments. Currently, we are running discounts on chemotherapy, radiation, and surgery. We understand that cancer treatment can be an expensive process. So, to reduce that burden, you can avail these offers. And if you want to know more about it, please feel free to leave a comment below. And without further ado, let's begin with the session. So, Dr. Amit, we have a bunch of common questions that are generally asked about glioblastoma. And our very first question is, what is glioblastoma and what type of cancer is it?
Yeah. So glioblastoma is a form of tumor that happens mostly in the brain tissue. So what happens, there are connecting cells that connect and keep the whole bunch of neurons integrated inside the brain. Those connecting cells are also helping with the healing whenever there is some damage or something that happens. Those cells, some of them might turn abnormal and they might start growing uncontrollably. They divide 1 into 2, 2 to 4, 4 to 6, 4 to 8, 8 to 16, like that, keeps on growing in a geometric fashion. And glioblastoma is of the highest grade tumor of those cells is called glioblastoma. Means highest grade means grade 4. There are 4 grades that we have divided based on the aggressiveness of the tumor. Grade 1 and 2 are also called benign because they don't spread, they don't recur as much, they're not as aggressive. 3 and 4 are malignant brain tumors also, we call them, because they grow faster, there is a very high risk of recurrence, and they behave in a very highly aggressive manner. Okay. Glioblastoma is the top most of those of that glioma class of tumors. And unfortunately, it is most aggressive form of brain tumor where we find it very difficult to offer cure to our patients.
Okay, understood. So, doctor, are there any causes or risk factors that can cause glioblastoma?
There are no known risk factors as such. Like we don't lifestyle or other factors that happen to be important in breast cancer or other forms of cancer. Glioblastoma tumors or brain tumors generally happen on their own. As of today, we don't have enough information to pinpoint a particular cause. It's like cells are always dividing in our body and they keep on growing. Whenever there is this copy formation is happening, sometimes that copy, like when we make a Xerox, sometimes some copy may go wrong. And then all the following copies of that particular cell would also become abnormal. And some of them might turn malignant, some of them might turn cancerous. Body still has a mechanism to control them. Every day we are having abnormal cells are getting formed in our body. Right. But body has a very robust mechanism to stop those abnormal cells from growing further. Though body does not make further copies of those abnormal cells. Sometimes some of those abnormal cells may evade that body's mechanism to remove them. And they stay hidden for some time and then they suddenly start growing. So but what makes them abnormal, especially in the cases of glioblastoma, unfortunately, as of today, we do not have a definite idea.
Okay, understood. So are there any early symptoms of glioblastoma? If we can observe the early symptom, maybe do some preventative measures to reduce our risk. Is there anything like that?
There's no known way to reduce the risk because we don't know the causes of it. But one important thing that we can do is catch it early. With any cancer, with this also, we need to catch it early. Means we need to suspect. Now it's very difficult to suspect a brain tumor like that. The commonest symptom that happens with any brain tumor to begin with is a headache. Okay,
Okay.
but headache is not the commonest cause of headache is not a brain tumor. Commonest of cause of headache could be a stress, any form of tension, any physical stress, physical this thing, or migraine or other common causes, and even stroke and other factors. So, but headache, a persistent headache that is not going away, that is causing more problems, and which is associated with other symptoms. Now, other symptoms depend on where the tumor is located.
Okay.
Like the person is sleeping too much or becoming very disoriented, drowsy, that means frontal part of the brain or head region, it is affecting. The tumor is there. If it is in the middle or somewhere, there will be weakness in any of the arms or limbs.
Okay.
Arms, feet, leg, anywhere there is weakness. Weakness means you want to move, but the power or this thing that you have in the other side is not there in this side. So if you have headache plus any of these, drowsiness would come very late, in fact, but weakness in any of the limbs, fits may happen when tumor comes. So fits, anything that at least causes two symptoms together, we should immediately rush to a neurologist or a neurosurgeon to ensure that there is nothing happening. And not all brain tumors are glioblastomas. Glioblastomas are, in fact, not very common. Commonest brain tumors are mostly benign or low grade. So even if you happen to find a brain tumor, it may not be glioblastoma always.
Okay, understood. And doctor, how is glioblastoma diagnosed? Like how, if somebody has been experiencing some of these symptoms, then what is the next step that they can detect that it's glioblastoma?
So when you have any of such symptoms and you go to a neuro expert or any physician for that matter, they would examine you to understand if there is any deficit in your nervous system,
Okay.
neurological deficit that we call. And then they would ask you to get an MRI if they find it reasonable enough. Not all patients would be prescribed MRI, but many times we would suggest MRI or a CT scan. MRI is gold standard to find out about any brain tumor. CT scans are better for bleeding related problems like stroke or some things. So mostly they would advise MRI of brain, and MRI of brain would show presence of if there is any tumor process happening inside the brain. So mostly we diagnose, preliminary diagnosis happens through this. After that, glioblastoma as such, we can't call it based on the MRI itself. Tissue diagnosis is a must because glioblastoma we decide based on tissue features. Like grade 4, we don't call it grade 4 based on radiological features or MRI features. We call it based on tissue features. So if there is a tumor, that needs to be removed. So the surgeon would remove it, and once they remove, they would examine it in the lab, and then we get to know if it is glioblastoma and what further subtyping we do.
Okay. Okay. And my next question is, what are the treatment options for glioblastoma?
Yeah. So as I said, it's a diagnostic and treatment together happens when we remove the tumor. Now,
Okay.
normally when we remove cancers in other parts of the body, we remove tumor along with the healthy margin of tissue. So because tumor is not always what is visible to eyes. It's not like there are microscopic tentacles inside the healthy tissue that are present. But inside brain, you cannot cut the extra margin because that would damage the brain tissue. So you remove only what tumor you can remove. We call it gross total resection. Means all the gross tumor that is visible on the scan or to eyes while examining, while operating, they need to remove it. So gross total resection is the standard treatment so that all visible tumor is removed from the body. That is the first step. If you leave it, there is a very high risk of recurrence, because you're leaving active tumor cells which act as seed and they come back. So we need to remove it completely. That is the first step. After removing the visible part of tumor, there is still a very high risk of recurrence because there are, as I said, microscopic tentacular extensions into the healthy part surrounding areas. Now, those have also to be addressed. We cannot address them through surgery in brain. What we do, we address those cells, or we treat those cells, abnormal cells, using radiation. So after the surgery is done, tumor is removed, the visible tumor is removed. They would give you a gap of 3 to 4 weeks to heal, to settle down. And if there is any problem, to ensure that patient is doing fine. And after 4 weeks, 5th or 6th week, we start the radiation treatment. Radiation is nothing but X-rays. High energy X-rays are directed at the tumor cavity where the tumor was lying and surrounding healthy margin, where radiation is given for 6 weeks. Most of the times for glioblastoma, we give radiation for 6 weeks. Every day, 5 days per week, such 30 sittings are given. Different technologies are there for treating it. Along with that, we also give something called concurrent chemotherapy using a drug called temozolomide. Temozolomide has been found to be very effective in helping better outcomes when we give radiation. So every day, 1 hour before radiation treatment, you are asked to take a tablet. All days of the week you take for 6 weeks. So that helps you enhance the impact of radiation. So that way, we kind of improve the overall outcome. But unfortunately, after doing all this also, using best technology, many times we see most patients would have a recurrence in 1.5 to 2 years. So, but still, if we don't do anything, within 3 months, the disease comes back. So surgery followed by radiation along with chemotherapy using temozolomide. Once radiation is over after 6 weeks, monthly dose of temozolomide is also added for 5 days. So that way it is all 3 modalities: surgery, then radiation, along with that some oral tablet form chemotherapy is given to glioblastoma.
Understood. So, doctor, are there any possible side effects of these treatments?
Definitely, surgery carries its own risk, because if while operating, if the tumor is very deep seated or in a very critical location, while removing or the tumor, we might see some damage happening to the healthy parts of the brain. And depending on where that damage has happened or where that risk is there, we might find deficits, neurological deficits in that corresponding part of the body. Now, brain has a mapping of different parts of the body. So different parts of brain control or manage different parts of the body from neurological perspective. Depending on where the tumor is, where the damage might happen due to tumor or while operating or after surgery, the deficit might happen. So surgery in that way, and doctors are very careful while operating, because if they try too hard to remove, sometimes they may end up damaging the healthy brain tissue, which would cause more trouble. So sometimes something called subtotal resection. When we were doing cross total resection, now we do subtotal resection sometimes, because if the tumor is very deep seated, you cannot remove. Sometimes while you are operating, it becomes very difficult to differentiate between what is healthy tissue and what is tumor tissue. So you cannot cut out the healthy tissue. So that way, depending on the case-to-case basis, you might experience different forms of deficits or side effects after surgery. Majority of times, this tumor is located near to the surface. So we don't see damages from surgery most of the times, but depending on where it was located, how much damage it has caused by being present there, that may also cause a lot of side effects. After that, when we do radiation, causes its own some form of side effects. Like when you're giving radiation, the edema, the accumulation of fluid that was happening around the tumor may increase temporarily. So we give some tablets or some medications to reduce that edema. So when edema, that swelling happens inside the brain, because the whole head is closed area, there's no space to go out. It's a closed thing. There's no space. So whenever there is any accumulation of new thing, tumor or fluid or something, it increases pressure inside your head. And that causes headache. That, depending on how much pressure it is, that may cause different other problems like drowsiness, weakness in any limbs, headache, and other things. More commonest thing is sleepiness and headache. Normally, we manage them through medications, and it is done with. Temozolomide, when we give chemotherapy, some people experience vomitings or gastric disturbance. We give medicines for that also. It's temporary. Everything gets resolved for majority of patients.
Okay. Okay. So after the treatment, are there any follow-up tests, any follow-up procedures that needs to be done for a continuous period of time?
Very important question. Once the treatment is done, once we complete the radiation, first thing we do is we call you every month to check for your blood test, some blood tests, and advise temozolomide that is given for every month for at least 1 year.
Okay.
Mostly more than 1 year we don't need to give. We give for 1 year, and then after 3 months after radiation, or at least 2 months after radiation, we call you for a next scan, first scan, just to see what has happened. If there was any left out tumor earlier, has it remained static, or has it grown further, or has it gone away? You need to check. Or if there is any other new problem, if there is anything that has appeared. So we would do a first scan after 2 or 3 months after we complete radiation. And then we call you for every 3 months for first year at least for a checkup. Every month you are anyways taking that tablet. And after 1 year, depending on the situation, we may increase the frequency or decrease the frequency of visits. When first scan happens after 3 months, next scan happens after 6 months. And further, we decide mostly after 1 year only, we do further scans. If in between you experience, or if the patient experiences any problems or any new deficits or new issues, then we immediately do a scan to look if there is any recurrence or any new problem that has come. Otherwise, we don't repeat the scans too often.
Okay, understood. Like doctor, you said there's a higher chance of recurrence. So should patients watch for specific signs and symptoms after the treatment that can let them know that recurrence might happen?
Definitely. There is always, whenever there is a recurrence happening, they would start experiencing maybe more frequency of headaches, or specific symptoms on where the tumor was, depending on where the tumor would be located. So when we are discharging patients from treatment, we would tell them, depending on location of their tumor, we would tell them these kind of symptoms if they appear. Say, if it is right-sided tumor, they may experience symptoms on the left side of the body. So it's always cross. If the tumor is right-sided, they would experience symptoms on the left side of the body. If it is left-sided, they would experience symptoms on the right side of the body, if there is any recurrence or anything happening in that area. Headache, fits may happen. Normally, we continue anti-fit medications, anti-epileptic drugs, so that they don't experience. But still, they may experience some fits, sudden transient loss of consciousness, or other issues. Depending on where the tumor is located, there would be different types of symptoms. So maybe doctors, we do explain patients as to these 4 or 5 things. If you are experiencing, just let us know.
Okay. So my last question is, are there any clinical trials that offer additional treatment options for the patients?
Yeah, but there are some trials going on. Now we are going in the era of molecular oncology, where we are now normally also after the surgery, we examine that tissue for different forms of molecular markers. So there are different forms of molecular markers that help us understand the aggressiveness of the tumor, understand how, at least get us some basic idea as to how the tumor would behave further, how much response can be expected, and what is the risk or how soon we can expect a recurrence. So different types of IDH markers, MGMT for temozolomide and other markers are there, a lot of them. Now we do, and we just understand. We are trying to get some drugs that may be targeted therapy, maybe there, some clinical studies are going on. There are some drugs that are given in advanced stages of recurrence, where we try to add more time for the patient, but unfortunately, science has not reached a point where we would achieve cure. Hardly less than 10% of patients would survive 5 years or more with glioblastoma. Crossing 2 years also becomes very difficult. Majority of patients, like more than half of patients won't cross 2 years, and still, because of the fact that most of the diagnosis happens in a bit advanced stage. Stage means the size and all other factors are mattering here. We don't decide stage like we do in other cancers, but the very grade, and grade is same from day one. It's not like it starts from grade 1, 2, 3, 4. Grade of the tumor is mostly same. So it's not like if you have delayed, it became glioblastoma. It was glioblastoma from day one. So, but majority of the times we don't achieve curable success. Some of our patients have survived 5 years to 10 years also, but they are constantly on some form of treatment. If there is a recurrence, we operate and we try to remove it again, depending on how soon the recurrence has happened. From last treatment, we decide about giving further radiation or not. Then we also do radiosurgery procedures. If the recurrence is quite late, at least say 1 year after last radiation. If it is not operable, we go for radiosurgery. So there are multiple options depending on case-to-case basis, patient's general condition, time of recurrence. So these things we consider. And based on that, we decide whether we can offer any treatment or not.
Okay. Okay. So, Dr. Amit, that's all the questions that I had to ask from you. And before I wrap up this session, I would like to inform our audience, if you have any questions, any doubts, please leave a comment below. This session will be uploaded on our YouTube channel, so you can watch it again. And if you need any of our services, please feel free to call us on 79965 79965. And thank you so much to our audience as well for joining us in. Thank you so much, Dr. Amit. That's it. That's all we had.
Thank you.
Thank you.